And our coverage continues here at the World Healthcare Congress 2018 out of Washington, D.C. I'm Mabel, Jong, and I'm joined here by Matt Wallaert, who is Chief Behavioral Officer at Clover Health. Welcome. Thanks for stopping by.
Thanks for having me, Mabel. I appreciate it.
Well, tell me what Clover is first. I've never heard of it myself. So.
Sure. We're a couple years old. We're a Medicare Advantage insurance company. I always think of us sort of as a health outcomes company who monetizes through insurance, right? We're very patient-centric. We're about half of us are in New Jersey, half of us are in San Francisco, and we currently have plans in, we offer insurance in New Jersey, Texas, and Georgia.
Okay. And you're the Chief Behavioral Officer.
Chief Behavioral Officer,
And
yeah.
what is that?
Yeah, it's kind of an unusual title. There's only 3 people in the world that have it, and I'm the only one in medical insurance.
And you know this, that there are only 3 people?
There are only 3 of us. Well,
have
I've written extensively about the need for them. So I'm a social psychologist by training.
Okay.
And I left academia and started doing applied behavior change. Built a couple startups, went out to Microsoft for a while, and then came here to Clover. So I spent about a third of my time on how do actually we work differently as employees, like how does Clover think differently about how we work. About a third of my time is member and provider behavior change. So how do I help you actualize going to the gym? You've always, you want to work out, you want to eat healthy. How do I make that actually happen? How do I help providers deliver the care that they intend to deliver? And then the last third is really research and sort of process management within the organization for experimentation.
Okay. And so what are you finding through your work needs to happen in the healthcare space? Your company is only about a couple of years old.
Yeah, absolutely. And so actually that being new gives us a lot of flexibility, which has been really great for me, right? I've been there about 6 months. It's kind of a blank canvas to try some new things. Some things especially that have worked elsewhere and that we get to bring into healthcare, like intent. One of the things that happens often in healthcare is, we're like, did you get a flu shot? No, you really should get a flu shot. Here's all the reasons it's really important to get a flu shot. But we never say, did you intend to get a flu shot? Do you want to get a flu shot? Like, is that important to you? And so bringing back that sort of intent and goal-based stuff so that we can start to have really, truly patient-centric care. I think we've had the notion of patient-centric care for a long time. I think it's been tough for people to actualize. So, for example, we've collected 8,000 personal health goals. So we actually know for a significant portion of our population why they want to be healthy in the first place. And that means that when I talk to you, instead of you should really get a flu shot, I can say, hey, I know what's really important to you is playing with your grandkids. So let's talk about how a flu shot's going to make that possible and help protect them.
Okay, so in your messaging, when you reach out to consumers, you can address them from a very personal or desirable place to be reached.
Absolutely, and it's personalized messaging. It's also personalized action, knowing, about half the people who didn't get a flu shot last year wanted to and just weren't able to sort of actualize it, so they had sort of an intention-action gap. And the other 50% didn't have any intention of doing it in the first place. And so it's not just around, hey, I can talk to them differently. I can also build different programs for them, right? So I can say, hey, these people who really wanted to get a flu shot, what were the barriers there? What do we need to do flu shots at home? Do we need to go to churches? Like, what is the programming that we need to do to make it possible for them to close that intention-action gap?
Well, how do you know this works?
So you get one, in the early stages, we can do translational research, so we can bring things that have worked elsewhere in other industries to bear. But at the end of the day, it's really about measuring our own work. So we're pretty relentless about pilot test scale. And so we always are trying to do quantitative and qualitative testing at every step before we enlarge a program. So even if it's just, I'm going to try this with 20 people and we're going to see how it goes, and I'm going to understand, did it move the behavior, and then grow it and grow it and grow it. So at the beginning, I think it might work because it's worked elsewhere, or I have convergent evidence that tells me it might work. But in expansion, hopefully it proves itself, right? It should always tell you when it's ready to take the next step. In that way, it's like a kid, right? A kid tells you when they're ready to do something, right? You can sort of let a plan tell you, oh, I'm ready to move.
What's the message you want to leave with people about Clover Health?
Well, so I think more so than Clover, I think it's important that we really put behavior and behavior change at the center of healthcare, right? Whether we're talking about social determinants of health or whether we're talking about actually clinical level change, if we don't change people's health behaviors, we will not change their health outcomes. And so I think speaking to psychologists, social psychologists, bringing in more science, bringing in people who are experts in that behavior change is really key to reducing the cost and improving the outcomes of healthcare.
Okay, it's so nice to talk with you, Matt.
Thanks for having me, Mabel. I appreciate it.
And I'm Mabel, Jong. Thanks for sticking with us. More to come.